Good day, everybody. My name is Michael Shortridge, and today I'm going to be presenting a review of diabetes. That way we can get an understanding of the etiology, the treatment, and the assessment. I look forward to going over this with you because the purpose of this is to bring attention to how diabetes relates to our body, our mind, and our social interactions. We're going to explore evidence-based treatment, tools and instruments that are used to manage and study diabetes. We're also going to learn about the different types of diabetes. There are two types, type 1 and type 2, and each are different and affect our body differently. And we'll also learn that one is a long-term and one can actually be managed and controlled to where you can have no diabetes. Definition of the biopsychosocial model. They consider the biological, physiological, and the social factors. This is everything from genetics to our immune system, emotional behaviors, and cultural and environmental impacts. So when we look at the biological factors, we're looking at genetics, and family history plays a role when it comes to having a chance to develop diabetes. Diabetes can be present at birth, or it could be something that shows up a little later in life. Certain ethnicities have a higher genetic predisposition. With type 2 diabetes, this is the one that is manageable. This one, obesity is a big contributor to type 2 diabetes. And exercise and diet can really help manage type 2 diabetes. Whereas type 1 diabetes, this is when our immune system attacks the pancreas and the beta cells in the pancreas, not allowing for insulin production, causing high levels of glucose in the blood. When it comes to psychological factors, we're looking at stress, depression, and coping mechanisms. When our stress levels are high, we see a rise in cortisol. This increases the blood glucose levels in our system. Depression makes it harder to manage these symptoms because it can lead to poor habits such as eating, avoiding medical care, not adhering to medication. Stress and depression have a great link to the glycemic levels in our system. When we're depressed, our body tends to slow down. That creates a problem because then our body is not breaking down what we're putting inside of it. And when our body's not breaking down what we're putting inside of it, we begin to show signs of that, such as increased blood glucose levels. Social factors. Biggest problem with diabetes right now is cost. A lot of people don't have access to health care or even money to purchase medication that is needed to control diabetes. Even with health care, there is still a huge gap between the cost of medication and what the healthcare providers are willing to cover. Lack of family support and peer support can also hurt. If we have no one that is there to help encourage us or to assist us with becoming more active or making sure that we take our medication on time if we are a stubborn person who doesn't wish to take medication. There's a lot of people out there that do not wish to take medication or don't like taking medication, and they, with proper support. Children are dependent on adults for their medication. When their adults aren't active, it can really hinder the child. Them not getting their insulin shots on time. not eating the proper foods because they don't buy low sugar foods. A lot of these things in society contribute to an increased risk in diabetes. On the research side, we're seeing two different types. Inflammation is becoming a key player in insulin resistance. Inflammation has been linked now to so many different health issues. It does not allow the body to function the way it's supposed to function. Genetics play a key role. We are looking at genetic markers that can increase the likelihood of type 1 diabetes. But by finding these markers, we're also starting to understand type 1 diabetes. We can start to understand who is at risk of developing type 1 diabetes when these markers are present. On the psychological side, research is looking into cognitive behavior therapy as well as stress reduction. Reduction in stress has been linked to a decrease of inflammation, which decreases the risk of diabetes. If we could get stress down, we could start to improve the glycemic levels in individuals. Cognitive behavior therapies help assist people with diets, but also managing their stress and understanding their disease, understanding the importance of taking medication on time, understanding the importance of being physically active, understanding why we should not eat certain foods. Understanding these things will decrease our risk factors. These will decrease the chances that the diabetes could be even harmful than what it already is. On the social side, they're looking at social support interventions, group therapies, group meetups, joining people together who have diabetes, bringing awareness to those who do not understand diabetes, walking fundraisers to help with research funds, creating community-based programs where people can go and learn and get information at no cost, helping people understand the importance of managing blood glucose levels so that they can assist their friends, their families. When we look at the medical approaches, there are two different types. So with type 1 diabetes, there is a need for a long-term treatment of insulin. Insulin is used when the blood glucose levels get too high. When those levels get too high, insulin injections need to be taken. These can come in the form of pumps or shots. Advancements today have created things such as the Omnipod and the Dexcom. One device can control and monitor your blood glucose level, while the other distributes insulin into your system at a push of a button on an app. This takes away the need to carry shots and needles, and also time management. Finding a place to go to do this, to dispose of the equipment once you're done properly, so that it doesn't cause any damage to anybody else if they find it in a garbage can. These new devices are helping those who have type 1 diabetes get more control of their diabetes and their life. On the type 2 sides, we've seen medication that has been out for a while but becoming popular now, especially in the celebrity community, and that's Ozempic and Mounjaro. Now, these are weight-controlled drugs. And what they do is they break down the sugars and the stored fats in our body, which and work as an appetite suppressant as well. Because when we break down our sugars, it looks like we just ate something. So because our body is processing foods that have been stored, like a hibernation. The problem with these medications are that they become kind of dependent. Removing these medications from our life can have drawbacks such as increased weight gain. Because our glucose levels can rise very rapidly. If an individual starts one of these programs, such as Ozempic or Mounjaro, it's best to have a plan in place in case you need to come off of them. Also, costs for these can be very expensive, even with healthcare. So, lifestyle interventions is diet and exercise. I cannot stress the importance of diet and exercise enough. No matter what it is, no matter whether it's diabetes, obesity, cancers, cardiac issues, diet and exercise is key. With diabetes, you're looking for low carbs and you're looking for low sugars. Carbs are a type of sugars, and they get into our body, and if not used properly, it can be stored. That will increase the blood glucose level in our system. We need carbohydrates for energy. If we're not doing physical activity, that energy is going to waste. It's not disappearing, it's being stored. Supports for diabetes, as mentioned before, the cognitive behavior therapy. This allows them to develop better coping strategies for managing stress and emotional eating. Motivational interviewing. It helps them explore and resolve behavior change. And self-management education for diabetes. It just improves a person's knowledge, gives them a chance to become self-efficient in managing their own diabetes. As I said, for a child, they need an adult, so it's important for an adult to understand how to manage a child's diabetic levels. Some assessment tools that are used, the HbA1c is basically the go-to test. And this measures the blood glucose levels of the past 2 to 3 months. It's the primary tool for diagnosing diabetes and assessing long-term control. There's a chart that is used. Anything below an A1C of 5.7 is normal. And anything above a 5.7 is at risk. Once you hit 7 to 8 on A1C, you're in the diabetic range, and treatment needs to be started whether it's type 1 or type 2. There's a questionnaire that evaluates how a person manages their diabetes, helps to improve and tailor interventions to individual needs. Not everyone's the same. Not everyone dies. Some people have food allergies. So we can't just say, oh, well, eat low carbs. Well, some of those low carb foods can cause an allergic reaction. Or maybe I don't have access to those kind of foods. Also, it helps understand what their access is to help. Do they have the ability to get the medication they need? Do they have the ability to get access to healthcare providers that they need? And then there's the distress scale, which monitors a person's mental risk of frustrations, guilt, anxiety, the problems like this is controlling my life. It's too much work. It's causing me to stress out. I'm constantly looking at my blood sugar level. I'm worried it's dropping. I'm just worried it's tiring. Also, do I have access to this medication? So this test allows us to get a gauge on an individual's stress levels. As for approaches right now, they're looking at combining medical treatment with psychological support to help with lifestyle changes. Social workers, patient care teams, all these are being trained and getting more involved with patients who have diabetes. The patient-centered care, that's where they tailor treatment to individual patients' needs, preferences, and goals. Working with the patient one-on-one helps them not only to understand diabetes, but also how they can treat it based on their lifestyle. The future direction is that there's a continuing increase in technology and medicine. And as we've seen with Ozempic, Mounjaro, the Omnipod, and the Dexcom, more and more technologies are being available to the public to manage glucose and diabetes. Key takeaways. So we looked at the biopsychosocial factors, how the mind, the body, and our environment plays a role in the development and progression of diabetes and also management of diabetes. We looked at effective treatments. We looked at evidence-based treatments that include medication, social support groups, cognitive therapies, all these to help us manage and control diabetes. And then we looked at the tools used to assess our diabetes. How do we test to see if you have diabetes? How do we test our stress levels? How do we test if our management programs are working? All those, whether it's the HbA1c test or the DDS, are essential to help patients cope with diabetes. And there's my references for this review. And I'd like to thank you. I hope some of this was informative. And if you have any questions, please post down in the link below. And I appreciate your time and learning about diabetes and how to treat it. Thank you.